Hey, science fans! Welcome back to another exciting episode where we explore the fascinating world of science. Today, we're diving into the world of communicable diseases. These are illnesses that can spread from one person to another, often through direct contact or through the air. These diseases can be transmitted in various ways, such as through a handshake, a cough, or a sneeze. It's amazing how something so small can have such a big impact. Ever heard of the flu? That's a communicable disease. It's a common example that many of us have experienced at some point in our lives. The flu is caused by a tiny little invader called a virus. These viruses are so small that you need a powerful microscope to see them. Now, there's another bunch of communicable diseases we're going to learn about: measles, malaria, dengue, chikungunya, and HIV. Each of these diseases has its own unique characteristics and ways of spreading. Measles is a serious viral infection that causes a rash, fever, and cough. It's highly contagious and can spread quickly among people who are not vaccinated. That's why it's super important to get vaccinated against it. Vaccines help protect us from these dangerous diseases and keep our communities safe. Malaria, dengue, and chikungunya are spread through mosquito bites. These tiny insects can carry some nasty diseases that can make us very sick. That's right, those pesky insects can carry some nasty diseases. Using mosquito repellent and sleeping under mosquito nets can help protect us from their bites. Malaria can make you really sick with fever, chills, and sweating. It's a serious disease that requires prompt medical attention. Dengue fever can cause high fever, headaches, and joint pain. It's important to stay hydrated and seek medical care if you suspect you have dengue. Chikungunya is similar to dengue, but with more intense joint pain. This pain can last for weeks or even months, making it difficult to move around. Finally, we have HIV, which attacks the body's immune system. This virus weakens the immune system, making it harder for the body to fight off infections and diseases. HIV is spread through contact with infected bodily fluids, such as blood, semen, and breast milk. It's important to be aware of how HIV is transmitted to protect yourself and others. It's important to protect yourself and others by practicing safe sex and avoiding sharing needles. Regular testing and early treatment can help manage HIV effectively. Remember, these are just a few examples of communicable diseases. There are many more out there, each with its own unique challenges and ways of spreading. It's crucial to practice good hygiene, like washing your hands frequently to prevent the spread of germs. Simple actions can make a big difference in keeping us healthy. Stay tuned for more exciting science. There's always something new to learn and discover in the world of science. Have you ever heard the word vector and thought of math class? Well, in the world of diseases, vectors are something completely different. They're like tiny little delivery trucks for germs. A vector is an organism, usually an insect, that carries and transmits a disease-causing agent from one organism to another. Remember those mosquitoes we talked about earlier? They're vectors for diseases like malaria, dengue, and chikungunya. Ticks are another example of vectors. They can transmit Lyme disease, a bacterial infection that can cause fever, headache, and fatigue. Fleas can transmit plague, a serious bacterial infection that was responsible for millions of deaths in the Middle Ages. It's amazing how these tiny creatures can have such a big impact on our health. Understanding vectors is crucial in preventing the spread of many diseases. So, we've talked about all these diseases, but how do we protect ourselves? That's where vaccines come in. Vaccines are like superheroes for your immune system. They're like a training program for your body to fight off infections. A vaccine is a substance that helps your body develop immunity to a specific disease. It contains a weakened or inactive form of the disease-causing agent, like a virus or bacteria. When you get vaccinated, your body learns to recognize and fight off the real deal if it ever encounters it. Immunization is the process of becoming protected from a disease through vaccination. It's like giving your body a suit of armor against harmful invaders. Vaccines are one of the greatest public health achievements in history. They have saved millions of lives and continue to protect us from preventable diseases. Remember, vaccines are safe, effective, and essential for a healthy life. Talk to your doctor about getting vaccinated and protecting yourself and your community. Section 4. Saying no to harmful substances. In this section, we will explore the importance of making healthy choices and the dangers of harmful substances. We all know that fruits, vegetables, and exercise are good for us. They help us stay strong, energetic, and healthy. But did you know that some things can be really harmful to our bodies? These substances can cause long-term damage and affect our overall well-being. That's right, I'm talking about tobacco, alcohol, and drugs. These substances might seem tempting, but they come with serious risks. Tobacco found in cigarettes and chewing tobacco contains nicotine, a highly addictive substance. Once you start, it can be very hard to stop. Smoking damages your lungs, heart, and blood vessels. Over time, this damage can become severe and irreversible. It can lead to serious health problems like cancer, heart disease, and stroke. These conditions can drastically reduce your quality of life. Alcohol, found in beer, wine, and liquor, is another substance that can be harmful, especially for young people. Drinking at a young age can interfere with brain development. Drinking alcohol can impair your judgment, coordination, and reaction time. This can lead to accidents, injuries, and even fatalities. It can also damage your liver, brain, and other organs. Long-term alcohol use can lead to chronic diseases and mental health issues. Drugs, both legal and illegal, can have serious consequences. Even prescription drugs can be dangerous if misused. They can alter your mood, behavior, and perception. This can make it difficult to function in daily life and maintain healthy relationships. Many drugs are highly addictive and can lead to overdose, addiction, and other health problems. Recovery can be a long and challenging process. Remember, your body is a temple, and it's important to treat it with respect. Practicing mindfulness and making healthy choices can help you stay on the right path. Saying no to tobacco, alcohol, and drugs is the best way to protect your health and well-being. Surround yourself with supportive friends and family who encourage healthy habits. Section 5. First Aid Fundamentals. Emergencies happen, but knowing what to do can make a big difference. First aid is the immediate care given to someone who's injured or suddenly becomes ill. First aid is not about being a doctor, it's about knowing the basics to help stabilize a situation before professional help arrives. It could be as simple as cleaning a small wound or calling 911 in a more serious situation. Knowing basic first aid is like having a superpower. You can help someone in need and potentially save a life. In the following sections, we'll cover some common first aid situations and what you can do to help effectively. Section 6. First Aid in Action. From burns to bites. In this section, we will cover a range of first aid techniques that can be life-saving in various situations, from minor burns to severe bites. Now that we know the importance of first aid, let's delve into some essential first aid procedures for common injuries and emergencies. These skills are crucial for everyone to know, as they can make a significant difference in the outcome of an emergency. Burns. For minor burns, cool the area with cool running water for 10 to 20 minutes. This helps to reduce pain and swelling by dissipating the heat from the burn. Do not use ice or butter, as these can cause further damage to the skin. Cover the burn with a sterile dressing to protect it from infection and further injury. For severe burns, call 911 immediately. Severe burns can lead to shock and other complications, so prompt medical attention is essential. Bleeding. Apply direct pressure to the wound with a clean cloth to stop bleeding. This helps to control blood loss and allows the blood to clot. Elevate the injured area if possible, as this can reduce blood flow to the area and minimize swelling. Fractures. Immobilize the injured area with a splint or sling to prevent further injury and reduce pain. Do not try to straighten a broken bone. Seek medical attention immediately, as improper handling can cause more damage. Objects in the eye. Do not rub the eye, as this can cause scratches on the cornea. Try to flush the object out with clean water or saline solution. If the object does not come out, seek medical help. Unconsciousness. Check for breathing and pulse. If the person is not breathing, their life is in immediate danger. If the person is not breathing, call 911 and begin CPR if trained. CPR can keep oxygenated blood flowing to the brain and other vital organs until professional help arrives. Swallowing poison. Call the Poison Control Center immediately. They can provide specific instructions based on the type of poison ingested. Do not try to induce vomiting unless instructed by a medical professional, as this can cause more harm. Snake bites. Keep the victim calm and still. Immobilize the bitten limb to slow the spread of venom. Do not try to suck out the venom, as this can introduce bacteria into the wound and cause infection. Call 911 or transport the victim to a hospital immediately. Time is critical in treating snake bites. Stings. Remove the stinger if present by scraping it with a credit card or your fingernail. This helps to prevent more venom from being released. Wash the area with soap and water to reduce the risk of infection. Apply a cold compress to reduce swelling and alleviate pain. Remember, these are just basic first aid procedures. They are meant to provide immediate care until professional help can be obtained. It's crucial to seek professional medical help for any serious injury or illness. Proper medical care can prevent complications and ensure a better recovery. Section 7. Staying safe and healthy. Your action plan. Congratulations, science explorers. We've learned about communicable diseases, vectors, vaccines, harmful substances, and first aid. Now, it's time to put our knowledge into action. Remember to practice good hygiene, like washing your hands frequently and covering your coughs and sneezes. Get vaccinated to protect yourself and others from preventable diseases. Make healthy choices by saying no to tobacco, alcohol, and drugs. Learn basic first aid procedures so you can be prepared to help in case of an emergency. By following these tips, you can stay safe, healthy, and ready to tackle any challenge that comes your way. Keep those brains curious and always remember, science rules.